like you can see, our troubles are all the same. You wanna be where everybody knows your name.
Sam and Diane, thank you for inviting me here. What an honor it is to be sitting here in one of my favorite places, talking to my favorite people and presenting a financial plan to you. I need to start by saying congratulations. Receiving only your financial advice from Coach up to this point has gotten you a wonderful foundation. By maximizing your SEP IRA, you've accumulated almost $1 million in investment towards retirement. You refinanced your mortgage at the perfect time while interest rates were low, and it's going to be paid off by age 60. You've also been able to financially support Norm and Cliff up to this point. And now that they're no longer liabilities, you see the opportunity to redirect some of that cash flow to maximize what you do over the home stretch towards retirement. So let's get right into the goals. You stated that you would like $10,000 a month in living expenses, above and beyond any liability payments, taxes, insurance premiums. And also, you always had in the back of your mind that 65 was the age, but you'd like to explore if 60 was possible. Taking a look at projecting out the current situation with absolutely no changes, there's a 66% chance that you can retire at age 60. Now, you mentioned 65 based on some advice you received from Coach. And as much as I love Coach, his information is a little bit outdated. When he was getting ready to retire, 65 was the magic number. Because back then, there was no Affordable Care Act. You had to work to age 65 to get Medicare, or you'd have to qualify, excluding pre-existing conditions for medical insurance, and premiums in Massachusetts for a married couple is $2,500 or more for a high deductible plan. So thank you for connecting with me on LinkedIn and downloading that ebook, and I know that's what started this conversation, but I just want to summarize that ebook and show you some simple changes we can make. In order to maximize the benefits you'd be eligible for, the subsidies and the cost share reductions, we want to try and keep your modified adjusted gross income to 200% of the federal poverty level. That is currently, in today's dollars, $35,000 per year. Now you wanted $120,000 of income. 10,000 times 12 is $120,000. If only 35,000 of it can come from the current sources that you've accumulated, the SEP IRA, capital gains, Social Security, we have a pretty substantial gap to fill. We need $85,000 in assets that we can draw down that do not affect your MAGI. I have a complete list of these in the ebook, but for our purposes, let's just take a look at what we need to accumulate and then figure out how to do it. So 5 times 85,000 is $425,000 in today's numbers. Of course, we have to account for inflation, so we're going to try and shoot for at least $500,000 in assets. So at no point during age 60 to 65, we need to take a distribution from something that's going to affect your benefits. So here is my computer screen, and here's the plan I've been working on. So on this one page, we can take a look at all the impact of the recommendations I'm making on the current situation. So the blue line is currently where you are, and showing that there's a 66% chance that you're not going to run out of money. Money's going to last age 100. And the mean, the average of what the inheritance is going to be is $1.3 million. Like I said, not a bad situation to be in. But by making some small changes, we can make a humongous impact on where you're going to be. First thing is health savings account. I love HSAs. They're the only investment that you get a tax deduction going in. The money goes tax-free, and if used for healthcare, it goes tax-free. I want this to fund your healthcare and retirement completely tax-free. And I also want you to stop using the money for prescriptions, co-pays, going to the pharmacy and buying bandages. That's got to stop. You would not go to dinner tonight and take money out of your Roth IRA. We want this money to keep on compounding and compounding over the years tax-free. So let's maximize that. Next thing is we're also talking about taxes for the next one. We need $500,000 in MAGI-friendly assets to get the Affordable Care Act to a strategy to work. I want you to accumulate a lot more than that. We're going to get some tax diversification here, get some flexibility to do some amazing planning. if we can maximize the Roth 401ks and stop doing this SEP IRAs, we're going to be able to get $1.5 million by age 60 into this bucket. So if we do that, that's going to open up opportunities to do some strategic tax bucket arbitrage, meaning we can fill up your tax brackets. Anytime you have a tax bracket starting in 1, we want to fill it up to the top. And then do some strategic Roth conversions throughout the years to make sure that you're never paying more than the one tax bracket that starts at 1, moving money at the lower rates into something like gross tax-free and let it keep on compounding. One of the observations I had on your current situation was at age 72, your required minimum distributions were projected to be $250,000 per year. Now, if you only need $120,000 in today's dollars, even with inflation, you're still taking about $100,000 more out of a taxable account that you do not need to live on. The government is forced you to pay tax on that money. So let's move money out at the lower brackets while we can into the tax-free brackets and let it keep on compounding. So let's see how that impact. So convert the Roth, do the Roth conversions. By doing this, we get early retirement health care. We have to adjust Diane's and Sam's earnings because now Cheers is going to be paying you guys, and then you're going to invest your money into the Roth 401k. So the money that they were directly, skipping over you, putting as an employer contribution to the SEP IRA, you no longer need the tax deduction there. So by doing this, we're looking at age 100, a potential inheritance increase of $9 million versus what we're showing to begin with. There's 4 places that your hard-earned money can go. First one's the IRS. Second one is a nursing home. Third one's a family member, a loved one. And fourth one is a charity. So by directing and intentionally planning for those, talking about the money that you need to live on versus the money you want to leave on, and having a plan in place to have that money efficiently pass on to the next generation has this much of impact. So while we're not saving more, we're just saving differently. And we're not making the number one beneficiary Norm and Cliff instead of the IRS.
Sometimes you wanna go where everybody knows your name.